Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is the Minister of Health, Tyler Shandro, and Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Minister Shandro will open today's update.
Thanks, Tom, and good afternoon, everyone. And so as we announced yesterday, Step 2 allows for some individual and some group fitness to go ahead. And there's been considerable confusion about what is allowed and what is not allowed. So Dr. Hinshaw and I are here today to clear some things up. And let me start off by saying that this pandemic has been challenging for all of us, and our government has been committed to providing the clearest information that we can. Anytime there's confusion or there are questions, we'll work to address them and provide answers to Albertans as best as we can. Now, yesterday, we announced a small change to allow more Albertans to resume indoor fitness. Now, Dr. Hinshaw will review the details in a moment, but let me be clear. If you operate a gym, you can be open. That is perfectly within the rules. Before we announced Step 2, we consulted with the fitness sector about how to safely support their industry. And they told us clearly that they supported us going to an approach similar to the one that is used in BC. And that's what we did. And it's why we adopted the distinction of high versus low intensity. Now, low intensity solo and group fitness activities will now be allowed indoors. They can be done anytime, provided that you make an appointment. Low intensity fitness is stuff that doesn't make you breathe significantly harder than you usually do. High intensity fitness is any kind of exercise that does make you breathe a lot harder than usual. And the higher your heart rate, the higher your breathing rate will be. Now, it's not about what activity you're doing or where, it's about the intensity. Now, we know that this will vary between people and depending on somebody's individual level of fitness. And that's why gym and studio and fitness center operators need to use their best judgment in identifying what category their group exercises or exercise classes fall into. And we've worked with the fitness industry from the beginning and will continue to do so. We recognize that this is challenging and there are going to be questions, there are going to be issues about exactly how to apply this in practice. So I want to be clear. We're relying on owners and clients to use judgment, to show good faith. We need people to follow the rules. But as with all of AHS's work to enforce public health measures, the goal is compliance. It's not sanctions. We're not looking for opportunities to hand out tickets. We're not looking to close businesses. We want people to use gyms and other facilities safely. Enforcement, remember, is only ever a last resort. I should also say that we'll be hosting a telephone town hall with fitness operators shortly to answer any confusion that they may be feeling, to answer their questions. And as I said yesterday, Step 2 is another safe, another smart step forward for our province. We're proceeding cautiously, but we're also hoping that we can ease more measures in the coming weeks if we see our triggers start to decline again. And thank you very much. I'll now invite Dr. Hinshaw to provide today's COVID-19 update and more detailed information about how these measures apply to gyms. Thank you.
Thank you, Minister, and good afternoon. Before I begin, I'd like to let you know that AHS is performing an upgrade to the AHS online immunization booking tool. This upgrade will temporarily prevent access to the booking tool from 2 a.m. to 4 a.m. tomorrow morning. Access to HealthLink 811 will not be affected and remains readily available. This upgrade will improve the capacity of online booking systems, helping ensure Albertans are able to book their immunization appointments as seamlessly and efficiently as possible. The time frame for the upgrade was chosen to cause the least disruption to the online booking process for Albertans. Turning to today's update, more than 245,000 doses of vaccine have now been administered across the province. More than 156,000 Albertans have received at least one dose, including more than 88,000 who are now fully immunized with 2 doses. Over the last 24 hours, we have identified 257 new cases of COVID-19. We completed about 5,864 tests, and our positivity rate is about 4.5%. Looking to schools, there are currently active alerts or outbreaks in 228 schools, or about 9% of all schools in the province. These schools have had a combined total of 876 cases since January 11th. We have identified 35 additional cases of the variant, bringing our total to 492. There are currently 261 people in hospital, including 54 admitted to the ICU. Sadly, I must announce that 2 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family and friends of these individuals and to anyone who is mourning a loss. I'd like to provide a bit more context to what Minister Shandro said about how we've determined the protocols and requirements for fitness facilities in Step 2. As Chief Medical Officer of Health, I recognize the important role physical activity and fitness play in our overall physical and mental health. That's why we've worked hard to find ways to safely open up fitness facilities for lower risk activities in collaboration with the operators of these facilities. We heard from fitness industry representatives in the multiple meetings our team has had with them how important it is for us to underline the critical role that physical activity has in both physical and mental health. We heard that allowing appointment-based solo activity was important, and we heard that fitness owners are committed to creating safe environments to prevent COVID-19 spread. We also heard from some stakeholders that the BC model that uses a differentiation between high and low intensity exercise had been successful in that province. We know that COVID-19 spreads in droplets, and when we are engaged in high-intensity activities, defined, as you heard the minister say, as activities where our breathing rate gets faster, we know that we produce more droplets and increase the risk of virus spread. We know that BC has had a similar approach to this model in place for many months, and that their COVID-19 numbers have been relatively stable. With this in mind, we looked for ways to open up facilities for Albertans that would allow for low-intensity activities in gyms, and we chose to implement an approach similar to BC. This empowers operators to tailor their programs for clients to calibrate their services to the activities that will improve fitness while minimizing COVID-19 risk. We've heard questions about why there aren't capacity limits for fitness facilities like there are for other public settings like retail stores. Rather than a defined number, we have limited capacity by putting in place physical distancing protocols that require a minimum of 3 meters between all individuals. This approach still limits the capacity of facilities for safety, but is more flexible and responsive to the spacing and configuration of individual workout areas, rather than a specific number. This is important to ensure people are adequately spaced to reduce the chances of transmission between people from different households. I know that finding ways to stay active when gyms are closed can be more difficult in the cold winter months. Fortunately, the days are getting warmer and longer, so that provides more opportunities for everyone to get outside for exercise and fresh air. Our current health measures still allow for outdoor physical activity in groups of up to 10 individuals distanced by 2 meters, no matter the intensity. This remains a great alternative for those who don't want to work out indoors or who may not be able to book an appointment at a time that works for them at their nearest gym. We will continue to work with operators to address concerns and clarify the current measures in place. As operators and users adjust to the new framework, Alberta Health Services will work closely with them to provide education and support, as is always our public health approach. Penalties would only be used when there are intentional and repeated violations of safety rules. I'd like to end today by repeating what I said yesterday. The future is up to all of us. There is no guarantee that cases will decline in the near future. It will only happen by all of us working hard together to follow the spirit of these measures every day. We all need to keep making safe choices to start bending the curve back down. Thank you, and we're happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Jeff Black with 660 News. Go ahead, Jeff.
Hi there. This question's for Dr. Hinshaw. Yesterday, the reason why we didn't fully move into step 2 was because there was a concern about the higher positivity rate and the R value increase. Do we know what's behind this rise, and is this possibly contributed to phase 1 of the reopening plan?
It's very difficult to know exactly what all the factors are, and so we know from our data that about, as I mentioned yesterday, about 1% of transmission we're seeing that we can clearly identify back to things like retail and restaurants, whereas there still are about 30% of our active cases where we haven't been able to identify the source. I would say that based on what we're hearing from stakeholders, what we're hearing from people across the province, is that there is a mix, and we're hearing that some people are, and I would say quite frankly, all of us are very tired of the restrictions, and that some people are perhaps not feeling willing to follow them anymore. So it's very difficult to differentiate between the transmission that's happening in the activities that have been opened up in step 1 and differentiate between transmission that's happening when people are engaging in other activities that aren't currently allowed, but unfortunately, again, where people are just feeling frustrated and wanting to expand the amount of activities that they're able to do. So we don't have any single driving factor. But again, what we know is that the opportunity for the virus to spread from one person to many happens where we have people together outside of the same household where one person's infectious and the virus can just take off in those settings, which is why we've continued to put limits in place to prevent that from happening.
Operator, could you put through the next caller, please?
Sorry, next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. I asked the health minister about this earlier today, but I'd be curious to hear your thoughts. BC is delaying second doses of the vaccines for 4 months, and the minister said that Alberta is considering doing something similar. So can you just talk a bit more about what specifically you're looking at, what potential timelines that might be, and then in terms of public confidence, we're hearing from the drug companies saying, don't go further than kind of our initial recommendations. And you've got government saying, no, we can go longer. So how should the public kind of make sense of government policies kind of differing from what we're hearing from the manufacturers?
One of the critical things in our response to COVID-19 is that we base our decisions on the available evidence, and the available evidence emerges over time. With COVID, of course, we need to make sure that we're keeping up with that emerging evidence. And one of the things that's really encouraging that's coming out of real-world experiences with using the Pfizer and Moderna vaccines is seeing high levels of protection from the first dose that last for several months. And I think that it's really important as we're looking at decisions, as we are in Alberta, about how we best protect our population, that we're using real-world experience and real-world evidence, and that we're making decisions based on that, and that we are using the best science, and again, thinking about that overall impact. So we are looking again at the evidence. We're having conversations with colleagues across the country, and we expect that we will be making a decision soon on that topic.
Operator, could you put through the next caller, please?
Next is Sean Burnett with CTV. Go ahead, Sean.
Hello, Doctor. With Alberta getting 60,000 doses of the Astrazeneca vaccine this week, who will receive that vaccine first?
I don't believe we received our final allocation, and in terms of the specific timing of arrival, again, not sure if we have the exact dates on that yet. So I just want to be clear that the vaccine arrival time maybe next week, in fact. We are looking very carefully at options. This is an important decision to make. And so we will be able to provide additional information to Albertans once we have finalized, again, those critical pieces, looking at all of the factors about this vaccine and who would be able to benefit from it. And that information, again, will be coming soon.
Operator, could you put through the next caller, please?
Next is Dylan Short with Post Media. I'm sorry. Next is Janet French with CBC. Go ahead, Janet.
Hi there. Thanks for taking my question. It's actually for Minister Shandro. Regarding the tentative agreement with doctors, some physicians might argue that any agreement is potentially meaningless while the changes that came in Bill 21 are still in place, which gives your government the power to terminate unilaterally any agreement with doctors. So I'm curious, do you plan on removing that clause from the Alberta Healthcare Insurance Act? And is that part of the agreement, the tentative agreement with doctors?
Thanks, Janet. So first of all, that actually wasn't in the legislation. Just to reiterate this again, I know I've been asked this many times over the last year, but that's not at all what was in that legislation. It was actually in the agreement. The previous master agreement with the AMA allowed the agreement to be terminated in two ways, by mutual agreement of the parties or by operation of law. And so what we did through legislation, it was merely clarify. The operation of by law could mean ministerial order, order in council, or legislation. We merely clarified that it would be by order in council. So that was all that was there. Now, this new tentative agreement does propose what would happen at the end of an agreement and how it would be terminated by mutual agreement of the parties. So I think as well, what else is included in the agreement? I think it's important for me at this time to be respectful of the Alberta Medical Association and their members. Their rep forum is going to be meeting, I think, fairly soon in the coming days, maybe even this weekend, for them to review it, and after that for a ratification vote to their membership. And at that time, be happy to talk about specifics, but until their members have had a chance to review, I want to be respectful of the AMA and their members and not be getting into specifics about what might be included in the agreement at this time. Thank you, Janet.
Operator, could you put through the next caller, please?
Now we have Dylan Short with Post Media. Go ahead, Dylan.
Hello, and thanks for taking my question today. You had mentioned, Dr. Hinshaw, that fines would be kept for gyms, I guess, that continuously disobey these rules and guidance. We're seeing a church, obviously Grace Life outside of Edmonton, continuously disobey gathering rules. We know that there have been some fines and measures taken there, but I guess with the continued disobedience, are we going to see more being done about this church?
We know that the vast majority of Albertans, the vast majority of businesses, the vast majority of faith organizations in this province are working together to prevent the spread of COVID-19 and to follow the rules, follow the requirements of the law currently in the province. With respect to enforcement of any particular organization, including the particular church that you mentioned, those decisions are made by the enforcement officers on the ground who have the independence to be able to make decisions about the most appropriate tools to use when individuals or organizations are not following the law, and that's not something that I interfere with. Again, I want to reiterate that the choice to specifically go against the rules is not the norm. That, again, I greatly appreciate that the majority of organizations, and in this particular case want to acknowledge the majority of faith organizations who are caring for their communities and making sure that they are caring for their neighbors by following the COVID-19 restrictions that are currently in place for safety.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Next is, sorry, we just had a couple of people leave the queue. Next is Jesse Weisner with Global TV. Go ahead, Jesse.
Hi, thanks for taking my question, Dr. Hinshaw. Wondering if the province has more clearly defined who is included in Phase 2 Group C in terms of healthcare workers. What type of workers are health officials looking at, and when can we expect a decision on who is included in that group?
We recognize that healthcare workers and others identified in different phases of Group 2 are interested in clarity about specifically who is in those groups and how we will be validating and the participation in those groups and notifying people. And those details are being worked on. I want to point to the definition that was released, which is that healthcare workers who provide care, direct in-person care to individuals who are at high risk of severe outcomes would be included in that group. And again, we recognize that people do want very specific clarity about specific subgroups, and that is coming, but would just again point people to that particular definition, which is what we're using to look at who would be included in that particular group.
Minister Shandro has a supplement to that answer.
Thank you. And just further to what Dr. Hinshaw said, that we have, though, provided some clarity, at least for not family physicians, but community physicians and their staff, that they would at least be included in 2C. We had that concern raised to us by the Alberta Medical Association. We were very happy to at least make it clear in the interim before there's further decisions to be made about who's included in 2C, that those physicians and their staff would be included.
Operator, could you put through the second last question, please?
Julia Wong with Global News. Go ahead, Julia.
Hi, this question is for Dr. Hinshaw. Roughly 35% of active cases have an unknown source, and you did note yesterday that there is a high number of unknown sources because people are involved with multiple activities. At what point is that number too high? And as more sectors of the economy reopen, what needs to be done to bring that number down?
I would say there are a couple of things to bring that number down. With respect to the question of whether or not it's too high, I think that ultimately what's the most important is the number of new cases that we have. Are we growing or declining? And of course, the percentage of cases where we're able to identify the source is really important in terms of our ability to target interventions at locations where we are seeing transmission. So I think it's not a number that stands on its own. It's part of the whole picture when we're looking at all of our leading indicators. With respect to the interventions in place to bring it down, again, I really want to reiterate that this is something that the health system cannot do on its own, that we rely on all Albertans to be cognizant when they're out in the community, when they're interacting with people outside their household, that they are thinking about each interaction and minimizing the chance that there could be COVID spread. Because ultimately, when we identify somebody as having COVID, had been diagnosed with COVID, what we need to know is in those previous 14 days, who were they close enough with for long enough to potentially be able to spread COVID-19. And so when people are thinking about their activities, minimizing the chance that either they could be exposed or that they could expose others if they happen to be infected and not know it. First of all, that reduces our transmission. Second of all, as they're mindful, it helps them, if they are asked to detail their activities in those 14 days, to be able to provide more accurate information to the contact tracers and the case investigators. And we also need their participation in those phone calls to be able to provide us with as complete a list as possible. And what we are seeing sometimes, and I understand, especially when people get a phone call from a case investigator, sometimes those phone calls can be quite long, and I completely understand people may feel impatient and want to end the phone call, not for any ill reasons, just because it does take a long time. But I really encourage people, if you are identified as a case or a contact and you're asked to provide some of this information, that information is absolutely critical to our ability to controlling the spread of COVID-19 and to our ability to move forward in potentially easing more restrictions. So again, I would say it's a partnership. We have worked very hard to increase our contact tracing team, to increase the rigor of our data collection, and we continue to work on that end, but we need Albertans' help. This is a partnership, and we cannot do this without Albertans participating with us.
Operator, could you put through our final question, please?
Our final question will be again from Sean Burnett with CTV. Go ahead, Sean.
Thank you. This question is either for the minister or the doctor. A lot of the organizers of summer events had expected to perhaps know by now whether they should be going forward with plans for in-person events this summer. When will they know they can do that?
Sure, I'm happy to start off that answer. And we do appreciate, we know that events don't get planned overnight, that it takes many months. And especially for the large festivals that happen over a summer, a lot of the folks behind the scenes need to get started in working on those events going as far back as Q1 or at least Q2 for them to be able to get ready for those summer events. We've committed to having a table that is in the Emergency Operations Center that the incident commander is chairing for these festivals. We're continuing to work with them, and including Minister Ahir's office as well, so we can continue to work with them. And the hard part is that we are doing our best to make sure we're providing a path forward for Albertans, looking at for the stepping down of measures, looking at the lagging indicators. But we still can't know yet what our case growth might be in the coming months. And so while we plan for the possibility of there to be a step 4 in the summer months, we obviously don't know. We have to continue to monitor through Dr. Hinshaw's office, monitor those metrics to be able to see if there's going to be continued case growth. That might, as we've said before, might slow down a step in the path forward plan. It might mean if we see a concern in cases rising, a third wave coming in Alberta, that it might mean targeted measures, narrow measures that we'd have to impose again during the pandemic. But we have committed to working with these events organizers, these festival organizers, so that they can at least have the best information available to them through the incident commander and the Emergency Operations Center. Dr. Hinshaw?
Thank you, Minister. The one thing I would add to that is that as additional vaccines are approved for use in Canada and as we see our supply of vaccines starting to increase, one of the absolutely critical factors in being able to consider having larger events this summer will be the number of people who we are able to offer a vaccine to and the number of people who accept that offer. And the more Albertans who are taking us up on that offer when they're eligible, the more able we'll be to consider moving this summer, again, depending on timelines and vaccine availability, into potentially allowing some festivals that we weren't able to allow last summer, but that, again, depends on some of those factors that we're continuing to track and monitor, and so more information will be coming soon. But again, these are some of the critical considerations as we're looking forward.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.